Obesity can lead to heart failure in 5 ways. Number 1. Increased blood volume. Obese people tend to have more blood, which makes the heart work harder to pump. This is because of excess adipose tissue in obesity people requires more oxygen and high metabolic demand for expanded fat tissue, which leads to a hyperdynamic circulation and increases cardiac output. In moderate to severe cases of obesity, the increased blood volume and cardiac output can lead to left ventricular dilation, increased left ventricular wall stress, and left ventricular diastolic dysfunction. This is known as obesity cardiomyopathy, and it can result in congestive heart failure and sudden cardiac death. Number 2. Sleep apnea. Obesity is a common cause of sleep apnea, which can lead to high blood pressure and lung problems. High blood pressure can make the heart work harder, which can lead to heart failure. The other problem is excess weight can cause fat to build up in the neck and upper airway, which can narrow the airway and make it more likely to collapse during sleep. Fat deposits around the chest can compress the chest wall, which can reduce lung volume, muscle activity in the upper airway, and make it harder to breathe, and it contributes to sleep apnea, then causes heart failure. Obesity is a major risk factor for obstructive sleep apnea, the most common type of sleep apnea. In fact, 60 to 90% of adults with obstructive sleep apnea are overweight. A 10% weight gain can increase the risk of obstructive sleep apnea by 6 times. Number 3. Atherosclerosis. Excess weight, especially around the waist, can lead to fatty material building up in the arteries. This can damage and clog the arteries that carry blood to the heart, which can lead to a heart attack. Number 4. Structural changes to the heart. Obesity can cause structural and functional changes to the heart, such as left ventricle to thicken and dilate, which can lead to diastolic dysfunction. This can increase the risk of atrial fibrillation and sudden cardiac death. Number 5. Hormonal changes. Adipose tissue secretes hormones that can create a pro-inflammatory state, which can lead to coronary heart disease, heart failure, and sudden death. Obesity is an independent risk factor for cardiovascular disease and is associated with reduced life expectancy. Generally, obesity is a global epidemic that increases the risk of cardiovascular disease, even after adjusting for other risk factors like hypertension, diabetes, and dyslipidemia. Obesity can contribute to cardiovascular disease by increasing insulin resistance, causing endothelial dysfunction, activating the sympathetic nervous system, increasing vascular resistance, and promoting an inflammatory and prothrombotic state. Weight reduction and exercise are the main therapeutic options. I hope this lesson is helpful. Please like and subscribe for more lessons like this one. Thank you for watching.